Welcome to Nevada Newsmakers. On the broadcast today, the CEO of University Medical Center here in Las Vegas, Mason Van Houweling, for the whole show on an all-new Nevada Newsmakers. 40 years ago, Hotel California and the theme from Rocky were #1 on the pop charts, and D&D Roofing and Sheet Metal started on the road to becoming Nevada's leading roofing company.
I couldn't be more proud of what we've achieved.
And over these 40 years, we've become an employee-owned company. So when you're talking to any employee, you're talking to an owner.
And here's to the next 40 years.
Happy 40th birthday, D&D Roofing and Sheet Metal.
Retail's impact on Nevada's economy? Enormous. 8,600 businesses, large and small, employing 145,000 workers. And last fiscal year, retail paid tax on nearly $60 billion in sales. We're the Retail Association of Nevada. We support retail, we help it grow, and we mean business.
RANNV.org.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
Truck drivers are some of the hardest working people you'll meet, delivering over 70% of America's freight and 92% of Nevada's. When there's a natural disaster, they're delivering critical supplies to help those communities recover and rebuild. Every sector of the economy and our nation's military rely on truck drivers. So let's take a moment to say thank you. On the open road or city streets, our truck drivers are rolling to make our economy and our nation stronger. Trucking moves America forward.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, coming to you from the Las Vegas Metro Chamber in downtown Las Vegas. And we're delighted to welcome back to the program in his home base now, Mason Van Houweling. He's the CEO of University Medical Center. Pleasure to have you back on the program, sir.
Thank you, Sam. Thanks for the invitation, and it's good to be with you and your viewers.
Thank you. Let's start out with the legislative session. We've all had time to recover, spend some time relaxing, but what are your thoughts now that we're past the session?
Sure. It certainly was a historic one, being our 80th, and but certainly busy as well across all industries and throughout the entire state. Healthcare was not immune to that activity, so I think it was a very positive one for us. But most importantly for our patients and Nevadans here in the state. Very pleased that several pieces of legislation passed, starting off with pre-existing coverage protections for patients. I think that's an important one as Washington continues to talk about appealing or making alterations to the Affordable Care Act. We know in the state that Nevadans will be protected and we won't go backwards related to pre-existing conditions. Health and behavioral mental health issues have been addressed, and more funding towards crisis stabilization is important. Surprise billing, taking the patient out of the difficult position of being stuck with a large bill because providers and insurance companies can't come to resolution related to contracts, which is exciting that patients won't get caught up in that and don't have to worry about that. And then protections around shadow hospitals that operate in the shadows of hospitals that don't participate in Medicare and Medicaid was passed. So I'm excited about it. And then finally the Governor's Patient Protection Committee that will do a lot of work in between sessions to be able to advise on regulations, quality, outcomes, things that are important to our state. So I think it was a very productive session for Nevada.
Was there any discussion on insurance caps? Because that was another thing from the ACA that was a really important thing, to where if you had $1 million or $2 million policy and you came to the end of it, and there are some obviously illnesses that are going to go past that, they were covered by the ACA. Any protections from that in this legislative session?
Not so specifically on this session. I think the big issue was how do you remove patients from being surprised if they go seek care in an emergent situation, go to their closest emergency room, and then unwittingly not knowing that they were out of network, and then being stuck with a very large bill even though they were insured. So removes the patient out of that, and really makes the insurance companies and the providers come together in the best interest for the patient. So I suspect that this governor's patient protection committee, which across the board was supported from all industries and providers and specialists, will address those type of things in the next few years to be able to make recommendations to the governor. So I applaud him for doing that, and again, it was an overall very good session for healthcare, and I think the lawmakers and the leaders up in Carson did a great job this year.
I interviewed Senator Reid for the program yesterday, and in talking about Obamacare, he said it's just a disaster at this point in time.
Yeah, I think we will continue to see healthcare is not off the table. In fact, the federal government is looking at surprise billing on a national level. We still have a high amount of uninsured in our country and in our state, and as we look at the remaining uninsured, it is young adults, disproportionate demographics, particularly in the Hispanic population. We also have patients that are employed but low income, so you see a lot of uninsured in service, construction industries that potentially do meet some type of qualification because they're under the 300% poverty level. So getting the word out, making sure that they are aware of their access. But at the end of the day, we want to make sure employers are providing private insurance. We don't want to turn that upside down. We still think we need to stabilize the market, and that framework is working well. So ensuring that private insurance is out there and available to be able to provide access.
Do you have concerns about the number of people who are not buying insurance but are willing to pay the fine instead, and then you end up seeing them at the emergency room and it's the most expensive health care there is?
Yeah, that is a big concern and a very risky move, and really in that population we're seeing young adults employed, but they're opting not to take advantage of some of the plans. And again, in our state, we expanded Medicaid to allow for that, and in private marketplace. So, but one ER visit or one hospital admission, no matter where you're at, could be very costly. So we do want to encourage patients to have access via insurance, be able to get primary care medications, stay out of the hospital, get their annual checkups so they can avoid any acute illness.
And do you see more and more that we're going to a more healthy living situation for people to avoid ever coming to the hospital or coming to a doctor, just from a lifestyle point of view?
I think you see two ends of the spectrum. Certainly people are more conscious on the predictors for illness or at risk, but we also have the other extreme as well, where patients are not getting primary care access, they're not seeing a doctor, not talking about their diets, and there's a lot of technology that will allow patients to let them know what they're predisposed to as far as certain CDC diseases. So we're really seeing both ends of the spectrum.
And of course that continues to be a problem with primary care doctors. You're working with UNLV now in their medical school. What can you tell us about where we are with that?
Sure, very excited that the third year of UNLV School of Medicine, in fact their third class will be starting very shortly. And so another 60 students here in the state will be beginning their journey on being trained for the next generation of physicians. The third year of the medical students will be actually hitting the floors and shadowing and rounding with their attending physicians and their faculty. So very excited that the UNLV School of Medicine and UMC are partnered in training the next generation of physicians. We are still very short in many specialties. We fall behind in a lot of subspecialties. So,
for example,
mental health is a big issue, and that was addressed in the legislative session. We have 8.5 psychiatrists per capita compared to the rest of the country, which is around 16. So we're short in those areas. Pediatric specialties we are very short on. Critical care type of specialties, both on the physician and the nursing side. So we're doing all we can to attract and train healthcare workers here in the state.
So the doctors that are in training at UNLV and UMC, what are the plans to make sure that they not only do their residencies here, but then they end up living here?
Yeah, and so that's the big thing is we want to be able to train medical students, get them into residencies here in the state, and combined with residencies and training in the state of Nevada, the likelihood is around 70% that they'll stay and work in the state. But we have to have jobs. We have to have reimbursement. There's got to be fair reimbursement for those providers to be able to operate a practice and deliver care. So, but we're doing all we can to be able to give them every reason to stay here in the state and practice in Nevada. Is
there any problem with jobs? It would seem to me that that would be the least of the problems.
Yeah, there's no shortage of jobs. In fact, it's a very competitive environment for nurses. We're all competing for the same pool, but we're doing a good job from pulling from other states and attracting nurses and providers and doctors to the state of Nevada. So we've got a lot to offer here.
All right, let's take a break. More with Mason Van Houweling when we come back.
Tamarack Junction is South Reno's hotspot with over 450 of the latest slots and video games. Sully Sports Bar, the Dining Car Restaurant, William Hill Sportsbook, and the Tamarack Steakhouse and Lounge. We're just north of the Summit Mall in South Virginia. Yeah.
Ahern Rentals began as Signal Gas Station on Las Vegas Boulevard. Founder John Ahern grew the business by offering rentals. His son Don built on John's legacy, growing Ahern Rentals into the largest independently owned American rental company, with 89 locations in 30 states. Don also brought his experience and vision to equipment manufacturing with Extreme Manufacturing and Snorkel. Today, Ahern Rentals continues to bring its family values to a new generation. Learn more at ahern.com.
Hi, I'm Eric Robnett, owner of Home Energy Experts. Has this ever happened to you?
Honey, did you remember to turn down the thermostat?
Forgetting to set the temperature? Not fun. We can help. Our new smart thermostat keeps the temperature set for your comfort all by itself.
I'm feeling hot now.
To increase your comfort, go to homeenergyexperts.com for details. That's homeenergyexperts.com.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
The Tamarack Junction Steakhouse is known for signature steaks, handcrafted cocktails, and world-class wines. Join us Thursdays and Friday nights from 4:30 to 6:30 in the Steakhouse Lounge for live music, gourmet plates, and well-priced wines, just north of the Summit Mall on South Virginia.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center here in Las Vegas, which is the county hospital. You were talking about Medicare and Medicaid reimbursement levels. Whose responsibility is that? Is the federal government a part of setting that level, or is it entirely on the state?
It's a combination of both. The state will provide some federal match dollars that will go up to DC and that will come back to the state. So certainly we want to make sure that we're maximizing that opportunity at a state level to be able to provide reimbursement rates. You know, we are an expanded state here in Nevada, so we chose to expand Medicaid under the Affordable Care Act. So we went from around 200 enrollees. Now I was looking at the numbers. 2021, we're going to be approaching 700,000 in our state.
Wow.
So as you can see, that's going to be a tough budget to manage as you have more enrollees, but also the utilization has gone up. So you're and our uninsured's gone down. So we were around 20% in the state pre-ACA. We're down around 9%, and some of those populations that I talked about earlier still remain uninsured. But part of that, though, is as you have more enrollees, the utilization is going up quite a bit. We've seen the overall patient days in all the hospitals in the state go from about 18% up to 27%. We've seen the The emergency room visits go up about 139%. So there's a lot more activity. So the state is going to be really challenged on how do you manage that and patients getting care in the right setting. I mentioned the ER visits. Really, a lot of patients are still seeking their primary care, or when they get ill, they're not accessing primary care in the doctor's offices. They're seeking it out in the emergency room, which is the most expensive setting to be able to seek care. And also sometimes the longer waits, that because they're not true emergencies, they really should be in a quick care setting or a primary care setting. So I think the state is going to certainly be challenged to how do you manage that number of rollies long term, but also that uptick in utilization in the state.
So you've got, a heck of a conundrum. First of all, you're talking about 25% of the population within these two programs. That's a lot of people,
right.
And a huge increase. You're stuck with, a lack of primary care doctors. I've had friends who just moved to Reno from Spokane. The first thing they did was went to look for a doctor, and every doctor they hit, because they were already on Medicare, was saying, actually, we've got all the Medicare patients we can handle. And then the culture of people not understanding that you need to either go to a primary care doctor, a primary care facility of some kind, urgent care, etc., not going to the emergency room. So is there a need for perhaps a state-mandated a marketing campaign to say, this is what you do when you have a medical situation? It's the humidity, by the way.
Yeah.
A medical situation where you don't go to the emergency room first.
Yeah, I think there certainly needs to be those incentives to discourage going to the emergency room because of the ease of access. It's always open 24/7, no matter where you're at in the state. But yeah, I think there definitely needs to be more education. The state has done a good job of assigning primary care physicians, but to your point, is there enough? And it kind of goes back to doctors' offices and providers not only willing to accept, but being able to accept Medicaid because of some of the reimbursements. And quite honestly, that's the conversations that I have with state officials, but also local doctors, providers, that because the reimbursements don't really truly cover their costs, they're stuck in a tough business model on how do you sustain a business, but also attracting new physicians. When they look at our rates, our Medicaid spending per enrollee is far less than any other state. So I think that's the challenge that this administration is going to have, is how do you continue to balance that budget, maximize the federal dollars to be able to make sure that we're getting our fair share and ensuring that there's access, but patients are getting the right access at the right time. And again, it starts with the primary care physician, because they can do a lot. They can keep you out of the emergency rooms, but you just got to make sure you go and see your doctor.
How does consolidation play into this?
As far as
medical groups being taken in by hospital groups, so you're seeing less and less competition in those groups, because for example, in Reno, there's one urology group. Yeah. So if you're dissatisfied with that particular group, you have to go to Carson City, Sacramento, Las Vegas.
Right. You're absolutely right. We're seeing a lot of consolidation in the marketplace. In fact, there was just a big announcement yesterday with DaVita and Intermountain Healthcare.
Right.
That's currently not in this market, but has expressed entering into the market. And so you're seeing that collapsing of services, primary care, under a few large providers in the state. And so I think you'll continue to see that. But you hope that will bring more access, more efficiency, lower costs of overall healthcare dollars. And so we'll continue to watch that. At University Medical Center, we have taken a strategic approach to focus more on primary care and quick cares. We've added numerous locations throughout the valley here in Las Vegas. We're going to be announcing a new location in Henderson very soon. And so we continue to look out at the valley on where we can provide care closer to home in a easier access but less expensive setting for the patient.
Okay, so there's discussion now, and this is 20 years out at least, but everybody has to plan long term. The talk now about Ivanpah putting the second airport out there. There will be a huge community built around that airport, light rail between Ivanpah and the city. So are you already looking at plans to address the need that's going to come there and the opportunity that's going to come there?
Yeah, I think we're really getting good demographic and growth data as much as we can, and we look at that and try to project where the healthcare need is going to be. We do that strategically at the hospital, and the county does that as well on what type of services and infrastructure is going to be needed. But we certainly want to be ahead of that curve, be able to provide much needed healthcare to that population.
All right, let's take a break. More with Mason Van Houweling when we come back.
Dimitri Prine here for Design Outdoor. Come visit Design Outdoor's store and backyard to see our wide selection of fire pits, barbecues, and pizza ovens, natural stone water features and fountains, and frost-proof pottery. Our store and backyard are located at 11600 South Virginia, just north of DeMonte Ranch Parkway. Visit designoutdoor.com or call us at 851-9499.
Can't do it. Stupid, like my mom.
We can't do anything at Mommy's because you won't pay child support.
Dad said you cheated, and he's not even sure he's my dad.
Mommy said you left both of us, so she isn't gonna let me see you. I look just like my father.
I'm divorce attorney Marilyn York, and I may represent men, but hate has no gender, only casualties. Please, stop sacrificing your children in your war against your ex.
Hi, I'm Dave Newman. Remember me? I used to be the house detective, and now I'm a realtor, full-time at RE/MAX Realty Affiliates. A lot of people ask me, how's the market? You know what? It's fantastic. If you're even kicking around the idea of buying or selling, give me a call. Let's talk about it. Call me at RE/MAX Realty Affiliates and just ask for the guy who used to be the house detective, Dave Newman.
Everyone is talking about opioids, but they're not the only drugs that can be harmful if taken in large quantities or not as prescribed. You also need to be aware of side effects from anxiety drugs, muscle relaxants, sleep aids, and stimulants. Mixing prescription drugs with other drugs or alcohol can be dangerous. If you take Ambien with a glass of wine, it may be enough to stop you from breathing. Prescribed drugs can be just as dangerous as illegal drugs. Take medications only as directed.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center. We've talked a lot about marijuana on this program. We've talked to Planet 13, the largest dispensary in the country, and the thriving business that they have. We've talked with law enforcement, and they're dealing with it as the law has changed. We are not enforcing old laws, we are enforcing the new law, and they are not hysterical about people driving and trying to pull people over at every opportunity. They are dealing with it as this is now the law. But I'm curious as to what has been the response at the hospital. Are you seeing an increase in people over what you saw a couple of years ago with regard to marijuana concerns?
Sure. As I anecdotally speak to ER physicians and nurses and talk to our trauma team, we are seeing some upticks related to use of mind-altering substances and the availability of that. And I think many states have seen that. We kind of got on that early as we saw things changing here in our state and our county. And so we have seen an uprise in use, but also related accidents and incidents, whether it's a vehicle accident or motorcycle or moped, but also just pedestrian incidents related to that. So more concerning, it's been around the adolescent use. We've seen that. We operate a children's hospital, but we've seen a rise in that as we talk to our ER physicians. And
about what age group?
So you're seeing anywhere from 12 to 18. That's that population that seems to be able to have access somewhere that they're obtaining and getting their hands on it. And They're coming in the emergency department for a variety of reasons.
Could you share some of the reasons? Because I'm kind of curious, because I mean, you know, the thing that has struck me about this whole marijuana business is that who knew that so many people had been smoking marijuana or indulging in marijuana products for all these years, going back to the 60s and 70s, that they kept on utilizing it. And the senior citizens who have either continued using it or have rediscovered it for all the aches and pains and ailments. But obviously, anytime you're going to have an increase in the availability of a product, you're going to have issues with it. The question is, are the issues bigger than the benefit on the other side?
Yeah.
So what's your thought on that?
Yeah, and we are seeing those incidents of not being able to tolerate it or accidents related to it. You know, one of the other areas that I'm very concerned is expectant mothers. We already have an issue in our state of delivering underweight babies that end up in the NICUs or our neo ICUs. But we've also seen mothers using marijuana early on. For one, perhaps they're not aware, but also helping with morning sickness, that type of things. But as you know, that has ramifications on child development. So we're seeing that as well on the OB side of things. So we're going to continue to watch it.
Do you think the solution, well,
Sure.
you were heading that way.
Yeah.
Do you think the solution is, you know, because I've always said that I was always in favor of legalizing marijuana because it was being used, and tax it, regulate it, do all the things we're doing now. But the other side of it is take the money that you're profiting from it as a state and use that for heavy education on children and young populations.
Yeah, and I think that's an important initiative to be able to educate new moms that certainly you shouldn't be taking any type of drugs because of child development early on, and the first trimester especially. Also with children, letting them know the effects of that and the ramifications, both legally and ethically, those type of things. So
well, and absolutely health-wise.
Health-wise.
We're out of time on this one, but let's hook up soon and talk some more.
Definitely.
Pleasure to have you back on the program, sir.
Thank you, Sam. Always a pleasure.
Thank you, and we'll be right back.
A bird's eye captures its surroundings at different heights. At Brian Culpa Photography, we can make your imagination soar over buildings, parks, cityscapes, and beyond. Brian's images tell the story and get the job done. If you need a new perspective to tell your story, contact Brian today. Brian Culpa Photography. Experience the bird's eye view at brianculpaphotography.com.
Hey, Dad? Are you learning? This place is great. Huh? You gotta try this.
Wow, this stuff is great. People are gonna love it.
Yes. Yes, they will.
St. Ives Florist, for every holiday and every special occasion. For romance. Custom home design. We have the largest selection of fresh flowers in northern Nevada. And we also offer a large selection of unique gift items. Come see me, Lori Ann, at St. Ives Florist, 700 South Wells Avenue, or call me at 333-9190.
Our thanks to the Las Vegas Metro Chamber for hosting us, and always you can catch all of our shows at NevadaNewsmakers.com and on YouTube. We'll see you on the next broadcast.